some people will always be worse off, even if we have the same restrictions applied to everybody. And the reason is that some people are potentially more vulnerable to the impact. So we're aiming here, by using these restrictive measures, to protect some groups in society that are held to be more vulnerable. And as a means of protecting them, we are implementing these restrictive measures on the whole of the population. But we need to think about the impact that that has and how we make them as livable as possible. Hi, I'm Angus Dawson, Professor of Bioethics here at the University of Sydney. Welcome to my masterclass. I thought I'd begin by asking the question, what is ethics? Because not everybody will know. So when we think about ethics, we have to think about different kinds of reasons that we might give for our actions. And a particularly important set of reasons are those around what I would call justificatory reasons. So they are reasons that justify our actual actions or our potential actions. And a key focus is what we ought to do. For example, we could argue that we should aim at just outcomes, that is, outcomes that are just. Or we could aim at the kind of restrictions that are the least restrictive that are possible. So there are all kinds of different kinds of outcomes that we might focus on, and what we're interested in are a particular set of reasons for those outcomes. What is a pandemic? I'm sure other people have talked about this. I'm interested in this idea about a pandemic being something different. It's something that covers a large section of the world, a region within the world. It's something that extends beyond a local outbreak or a national epidemic. We are particularly thinking about the actions of a number of different national states. A pandemic requires essentially global coordination and global action. And that's one of the things that makes it difficult to respond to, because different countries have different priorities, they have different ideas about what's important. And what we're going to be talking about here are a number of different issues that arise in relation to thinking about pandemic ethics. So what I've done on the slide here is think about this focus on the global, which usefully illustrates a point that I often make when I'm talking about issues related to public health, which is that we're interested in ethical issues that are important for the whole of populations, not just individuals. So in this way, global pandemic ethics or public health ethics is different from more clinical ethics. I will come back to one clinical ethics case later on, but that's because it's something that is important across the whole of the world. And what's really important here is because, as I mentioned before, we're interested in the actions of states, we can think about this as being related to the obligations or the duties of states to essentially protect the population's health. And what I've got down here are 3 Ps, as I would call them. So thinking about health protection, the state's role there is crucial. So sometimes individuals can do things to protect their health, but the state can perform a particularly important role when we're thinking about infectious disease. Prevention is crucial here, because what we'd really like to do is to prevent the illness, the virus in this case, from spreading within the population. And that raises a number of different issues, which again, we'll come back to. And thinking about planning, it's really important to try and think in advance about what might happen. We all now have experience of what it's like to live in a world where a pandemic is raging. So arguably, we should be much better in the future at planning for the kinds of issues that come up in relation to pandemic ethics. And there are all kinds of issues that I could focus on, and what I had to do was just pick out a few to talk about. So where I'm going to start is with classic public health ethics, which is about the ethical issues to do with the public health measures that have been introduced as a means of trying to control the virus and therefore to protect us all. The first issue here is thinking about surveillance. And here I'm not so much thinking about cameras in the street following our every movement. It's more the idea of thinking about the role that collecting data about our health actually plays in being able, for example, to prioritize where we put our resources. So in an Australian context, that might mean that we're gathering this data at state and territory level, and then we can actually direct the resources to the state or territory that is most affected, and we can use our resources most effectively. So surveillance is a key method in public health. It's essentially trying to gather data about the level of infection within the population. Secondly, and this is where we all now have experience of living with different kinds of restriction, that we can have quarantine, which is a way of describing a situation where somebody has possibly been exposed to a virus, so may be infected, but we don't know that they are. Isolation is when we choose to isolate somebody that we know is infectious. So isolation literally means trying to remove that person from contact with anybody else so that there can be no infection passed on. Whereas quarantine is a sort of preventive measure with the idea that we are seeking to protect people, but the kinds of restrictions that there might be there could be less restrictive in the sense that you might be within a group of people that are quarantined. Next up is thinking about distancing. So we all know all about this now. The kinds of measures that are put in place. We should work at home when we can. We should not go to restaurants and shops and so on that aren't essential, aren't open. And that's to reduce all kinds of contact with other people within society. And then lastly, there's closing the borders. So there the thought is that that's a kind of special restriction. And if, as is the case currently in Australia, we have few cases, then by closing the borders, we are essentially protecting everybody that is inside those borders from other countries where the rates of infection might be higher and the infection might be imported into Australia. So why these raise ethical issues is because very often people focus on the idea of having the maximum amount of freedom or liberty to do what they want. And all of these measures to different degrees are putting restrictions upon the kind of movements that people have. So we can't do some of the things that we want to do. We can't travel to see family or friends to the degree that we might want. We can't go to restaurants or pubs. We can't go to concerts and so on. So these are major restrictions, and we have an issue about how we think about the relevant values or ethical considerations here. So do we think about trying to ensure the maximum amount of liberty, and we have the minimum amount of restriction? Or do we think what is actually potentially the most effective? So going back to my 3 Ps, if we think about protection, it might be that greater protection from a threat from a virus comes from greater restriction. But if we've chosen to prioritize the idea of liberty or freedom, then we might actually rule that out. So we have competing claims between what's most effective, potentially, and what's most liberty promoting. And we have to have a discussion about which of those we find more justifiable. And the last example there is the phase that we're now moving into. This becomes particularly important, is testing members of the population to determine who actually is infected as, again, a means of protecting the rest of the population, and following up with anybody that does test positive with the contacts that they might have had with other people. And then we use that to actually follow up with them, and in turn, they are then put into isolation as a means of protecting the population. So whenever we're talking about restriction, we can think about the impact upon the population as always being unequal. So some people will always be worse off, even if we have the same restrictions applied to everybody. And the reason is that some people are potentially more vulnerable to the impact. So we're aiming here, by using these restrictive measures, to protect some groups in society that are held to be more vulnerable. So the elderly, for example, have compromised immune systems, generally speaking, or people who have a chronic disease, which actually puts them at increased risk. And as a means of protecting them, we are implementing these restrictive measures on the whole of the population. But we need to think about the impact that that has and how we make them as livable as possible. So again, this is where this inequality issue comes in, because some people, the impact upon them from these restrictions is going to be more severe. So some people will be less resilient, they might be more vulnerable to depression or problems related to mental health. Some people might be worse off because they have lost their job or they can't work in the way that they normally do. And that's why we have various kinds of economic measures to actually help them. In some parts of the world, there has been far less thought given to the actual consequences for some people in society. And then the last thing here is thinking about how we might have some special populations that we need to think about. So for example, asylum seekers and refugees who are in a camp, they might be more vulnerable to infection once that infection gets in to the camp. The same kind of issue comes up in relation to prisons. And the thought here is that people will find it difficult, if not impossible, to actually implement the kind of physical distancing within those kinds of environments. So if you can keep the infections out of those areas, then it's a relatively safe environment. But once it comes into these enclosed spaces where people are very tightly packed together, then we're increasing the risk. And if there's any vulnerability in that population, then we could have a much worse outcome. So the ethical issue here is thinking about how we respond to disadvantage, how we respond to potential injustices that might come from the implementation of a policy, even if we think it's the right policy. So this is my slide, which is more about clinical care. And here I'm thinking about the way that we set up our healthcare systems and the implications that that has for how we respond when somebody gets ill. And I was involved with some colleagues in doing some work in preparation for a potential emergency where there was a real resource allocation crisis, where we had scarcity of ventilators or intensive care beds, and how should we actually allocate those limited resources. And here we have to think again in advance. Luckily at the moment it looks as though here in Australia we don't need to worry so much about this because of the number of cases, but in other parts of the world this has been a major problem. And what has happened is that very often doctors or other clinicians involved in the care of patients have had to make spur-of-the-moment decisions about who gets access to a ventilator, for example. And what we wanted to do was to avoid that, because it's extremely stressful to be faced by those kinds of decisions. So how can we put in place a system which actually helps people to make these kinds of choices? And if you look at the ethics literature, there are roughly 3 ways to think about this. The first is to focus on equality. So we treat everybody the same. And what that can mean is that you might have a system where there is literally a lottery. So you allocate access purely randomly, purely by chance. The second way is to focus on efficiency ideas, so trying to produce the best possible outcome. So there you might actually choose between patients and choose those patients that you believe are the ones who could potentially do best from being on a ventilator. They have a high certainty because of their medical condition, because of the lack of other chronic diseases that they have. They can actually be a priority here, and we have the best possible outcome in terms of the most people saved, the people who could potentially have the longest lives. And then the third possibility is to focus on, again, going back to the issue of disadvantage, to think about inequalities or differences in society and how we might effectively choose to prioritize as a means of compensating people for those disadvantages. Now, it's extremely controversial which of these you go for, but the overwhelming consensus in the ethics literature is to go for some version of the efficiency idea, that we, at least at the times of an emergency, where you truly have scarce resources, then we need to ensure that we get the best possible outcome out of our resources. So where we are now, thinking about actually coming out of the pandemic, at least the first stage here in Australia, we need to think about what the options are and how they themselves raise some ethical issues. So we don't currently have a vaccine. We don't currently have a very effective treatment. Hopefully, they will come soon. There is research being conducted in relation to both. Both of those, once they become available, will then raise further ethical issues about how we distribute those. And you could look back to the resource allocation ideas that I just mentioned to try and think about how we might distribute those within a country or across the globe. But the thing that I wanted to focus on is thinking about, as we currently are, we don't have a vaccine, we don't have a treatment. So what do we do? In a country like Australia, where we have the secure borders, we have the potential to allow limited travel into the country, and everybody that comes in would have to go into quarantine, we can think about what that means for immunity. And some people that have had the virus may well have longer lasting protection from that infection. And they essentially, if that's true, they have an advantage in that they could work in areas where it might be more problematic for other people to work. So I think one of the things that we can think about is what this actually means for society. Do we allow people to have that kind of advantage? What does it mean? Are we actually creating a new kind of inequality here in relation to people's, the status of their immune system? One of the disadvantages of Australia's success is that we have a low number of people that have been infected and that have survived, and therefore have levels of immunity that might be protective. So essentially, we have a country that hasn't got the kind of levels of immunity that other countries might have. And what that means is that we're at increased risk whenever a case is introduced, presumably from abroad. So there will be really strong pressure to make sure that testing is done on anybody who actually comes into the country. And that's going to have long-term implications, for example, for the tourist industry, for the transfer of international students to come here, for people to travel in general, and it might have implications for certain kinds of trade. So my conclusions are that when we think about pandemic ethics, it's really important that we don't just think about the ethical issues that come up in relation to an outbreak. And I think it's really interesting now that we look back at the available guidance that exists. I think a lot of what you would look towards for guidance as to how we ought to think about ethical issues in a pandemic, my personal view is that a lot of it failed to really take account of the severity of a global pandemic and what it really means. So, as I mentioned before, now we all know what that looks like. I think it's potentially time to look back and think a bit about how we ought to think about these significant infectious diseases at the global level and how we ought to respond. The second thing I wanted to mention was just that we have these huge big questions that I haven't had time to go into, but I think are going to be significant over the next few months. And the first one is this issue about how we balance different kind of components that are central to human well-being. So issues to do with protecting our health, preventing infectious disease, but also what the economic consequences of some of the measures have been, both in the short term and in the longer term. And one of the big issues that this potentially brings up, that I've flagged on the side here, is thinking about how essentially by introducing many of the restrictions, we've intentionally shut down sections of the economy, mainly to protect people who we believe could be potentially vulnerable to this disease, particularly the elderly and those with chronic disease. And essentially, we have accepted an economic burden for the benefit of those people. Now, the consequences are going to be a significant ethical burden for many years to come, possibly the next 20 years before we get to an economic surplus. So who are the people who are going to actually have to respond to that burden? It's mainly younger people. So the consequences of a pandemic are not just something that we need to think about in the here and now. We also need to think about issues related to intergenerational justice. We've essentially put into lockdown the majority of society. That can be for justifiable reasons as a means of protecting some people in society, but some people, other groups in society, are really going to bear the burden for that, potentially a lifelong burden, because this could impact on job prospects and superannuation contributions and so on. So maybe the people who are in their 20s now will still be suffering from the impact of COVID-19 in the moment when they retire.